it's 3 or 4 times more expensive to keep people in nursing home versus in the community. We have proven that over and over again.
Disability in Power with Theo Braddy and Matt Shedd, featuring disability rights news, policy, and advocacy. The overview.
I'm here again with Mr. Theo Braddy, the director of the National Council of Independent Living, NICL, as it's known. Mr. Theo, how are you today?
I'm good. How you doing, Matt?
I'm doing great. So we're talking today about a specific issue, home and community-based services, the attendant care crisis. You know, a lot of this is coming towards us because, if not all of it, because of this big, beautiful bill. Mm-hmm. You wrote a post recently on the NICL website, an article about policymakers making major decisions about HCBS without even really knowing what the services are or agreeing on terms. Can you give us a brief overview of the important terms and concepts before we dig into this?
The reason I wrote that is because like I said in the article, I was in a meeting and I logged off that meeting after, a number of decision makers was talking and key stakeholders were talking about home and community-based services, and they was using these different terms, and I'm saying to myself, they have a wrong understanding, right? And I finally realized what's been happening for quite some time now is that people definitions of certain terms are different, right? And it may be okay for you or myself to have some misunderstanding of terminology, but when it comes to people in charge of budgets and in charge of programs and budget cuts and legislative policies, those individuals can't be working and making decisions based on not fully understanding terminology, especially when it comes to home and community-based services. Because when you do that, and you don't have a great understanding of, the programs or the services that you are responsible for oversight or, policy, you start making decisions based on maybe, misinformation, maybe on misinterpretation of terms if you don't fully have an understanding of that, based on instead of having a firm reality-based understanding, right? And if you have a reality-based understanding of what that, mean to people with living with disabilities, right? And so then you can make better decisions, right? If you don't do that, you're operating with assumptions about something that is very essential to a person with disability life in regard to supports. And so as we do this stuff, we see more of it, Matt, from state to state, right? The inconsistency across states, and the systems are developed differently because one thing means this and another thing means this, and everybody who's in charge, like legislators and state legislators and representatives, it becoming even more important because, this big ugly bill is putting a bunch of decisions, leaving it up to the states, right? Through, different block grants and so forth. And when you do that, and you have all the decision makers not fully understanding what attendant care means, caregiver services mean, and their definition, if they're thinking of direct caregivers or direct services in regard to direct care workers in institutions, for example, you're not fully understanding what it means to live in a community with the necessary supports. You're thinking institutionalization, right? And when you have all of these decision makers creating these systems without great understanding of what these terminology means, like respite care and support brokers and all of that stuff, you get fragmented versions of a system that don't really adequately address the needs of the community of people with disabilities. that want to live in the community. And so HCBS becomes something different. It's not a foundational thing, right? And if you don't have that full understanding of it, Matt, it becomes very easy to cut, right? Because you believe you're doing, you are meeting all the needs, and you really are not, right? When you got this misunderstanding of words and service definition, it leads to workforce shortages. It leads to budget cuts. It leads to service gaps, which all get a lot of people, institutionalized into nursing homes, right? Because the services and supports that supposed to be available in the community is not.
If there's say someone can't afford a personal care attendant or transportation, and a person ends up in a nursing home, who ultimately is responsible?
Ultimately it is the taxpayers, right? Ultimately is increased Medicare, right? We know this to be true. It's 3 or 4 times more expensive to keep people in nursing home versus in the community. We have proven that over and over again, right? So when people are overly institutionalized, it becomes an increased burden on Medicaid, Medicare, right? And as well as, costs of the states and the federal government, right? Who, especially now, Matt, want to institutionalize folks more so than they want to keep them in the community. And so we're at a very difficult time because that slowly creep towards institutionalized bias versus a community living bias is becoming more rampant. And this is happening even with, it started off with 15 states. Now it's 9 states that are fighting Texas versus Kennedy, saying that Section 504 is unconstitutional. And is this costing too much money in regard to the community integration piece of Section 504? They are now saying that, isn't it? They're trying to say that that's too much for the state, and it isn't. Because we already said it's less to keep people in the community. So it got to be something else. That something else is that biased thinking. That something else is that misunderstanding about what it means to live in a community with adequate support services versus being institutionalized. So we got a bunch of folks with the bad understanding. And if you don't got the right understanding, let me say this. I don't think the problem is not that the decision makers don't care, right? The problem is they're making a lot of these decisions based on assumptions and not a really good understanding in regard to things that need to be clearly defined or agreed upon, right? And so when you got that kind of confusion, you're gonna, the end result is you got service gaps. You got, the workforce, because ain't nobody increasing the budget for these services, right? Because they think they're already being met. They got options. It's just institutionalized, folks.
Misconceptions.
And a good example of that, Matt, is something that occurred even in Pennsylvania here, is that, the governor was believing he was increasing, right? And he was boasting about, the monies he's allocating towards the caregiver services, but he was just talking about the services to people with ID and autism, right? He was, that's what in his mind, that's what he felt was meeting the needs. Whereas in Pennsylvania, deals with people with physical disabilities. While, people with autism and ID was getting increased rate for caregiver services, people with physical disabilities, their rate stayed at $8 and $9 per hour. And so based on that kind of understanding, that we also have different sections that we need to really understand, that the ID work differently than, providing attendant care services for people with disabilities. So that rate rarely ever gets increased. But, everybody know autism. everybody knows someone with intellectual disabilities. It's very easily understand because most of the decision makers, most of the legislators, they know someone with autism. They know someone with ID. Probably got a member in their family with that. Rarely do people who decision makers understand people with physical disabilities through accident, through injuries, right? And the need for those individuals to receive attendant care services. The largest increased rate of people going into nursing homes are under 30 range, right? That was proven through a study with NCD. And so you got all these young folks going into nursing homes, even more so now with the state being what it is in regard to all these Medicaid cuts and administration making all of these executive orders that are sort of forcing people into institutionalization, right? So we got to be very careful of having agreed upon understandings of what you're talking about when you talking about these systems, home and community-based services. And I don't think we all work with the same understanding. That's my biggest point. I think the more thing that we should be concerned about is the attitude. It's the negative attitudes and beliefs that these decision makers have, not fully understanding what community living really means and what it does for the community in regard to employment and in regard to education and all those things, right? In their minds, they're doing something that they feel is the right thing to do because, that's what they have learned how, let's institutionalize folks. Let's keep people with disabilities in back rooms. That's how we always have done it. That's why we created the other laws that said it was a crime for someone with physical disability to be seen in the community, right? And that's not that long ago when that was on the books, right? And so that's customs and traditions and laws and all of that in regard to how you should treat people with disabilities. And that is not archaic thinking. That is current thinking, even more so now with the administration in regard to trying to turn back the clock and get people with all types of disabilities and mental health issues institutionalized and get them off the streets, right? And if we are not seeing that slow movement towards institutionalization, we're not paying attention.
The real story.
Right now, federal government is pulling back, saying, we're going to reduce this or reduce that, and we're going to leave it up to state. The money that we give to the state is going to be up to the states. You know how wrong that is to leave these things up to the state and different governors and different state representatives who, like I said earlier, don't have a fully good understanding of these things. And they don't see home and community-based services as a priority, right? What get cut when we have to do things and make a balanced budget, state budget? First thing to get cut is those individuals who are marginalized, seniors, Medicaid, people with disabilities, homeless people, children. Those are the programs that get cut when the state look at their budgets. And so that's the problem, right? That's the real problem that we're facing right now. So the battle is going to become, I may be jumping ahead of you because I think I saw a question about this. The battle become, state by state right now. It used to be, and probably still is, that we still need to fight at the federal level, because if the federal government increased their amount of federal support, right, that will reduce the waiting list in certain states, right? When it becomes a state by state thing, one of the end results of that, Matt, is increased waiting lists, right, for home and community-based services. We've seen this over and over again. There's not enough federal match, or the percentage is low when it comes in. Governors and legislators First thing they do, start cutting. And then the waiting list increases. Instead of increasing to get people off the waiting list.
Right.
Right. Sometimes we see some states are doing it. Sometimes we see most states are not doing it. Because right now, even the states are being held prisoner by the administration. Yeah.
So,
And that's the thing, right? You know, that's the thing. When you leave certain things like that up to the government, you know, civil rights act and so forth, you know, had to be mandated by the federal government. The states
right.
weren't going to do certain things like that. Education, equal education, all of that stuff was pushed by federal. You know, you had a few states wanted to do it right, but most of it was, you know, mandated and enforced. Right now, we don't have, unfortunately, we don't have a Department of Justice that we can depend on right now. But that was the one place a lot of marginalized folks went to ensure that their rights was protected, including people with disabilities, right? Not anymore.
Right. So, you know, there's a two-pronged fight that we have to think about, it sounds like. We've got the state level, and then we've got the federal level. And just zooming out, what should someone with a more that wants to restore these things back to where they were, is that be elected as president, and they, you know, they make that a priority in terms of disability rights and funding? What would that, is the damage done now to such a degree that it would take a very long time to rebuild that? I mean, what would that look like?
Right now, though, with these decisions to, you know, leaving it to the state, you really got to get to your state people and you got to say, you know, we got to keep these programs in place. You know, the federal government made all these Medicaid cuts. You know, they're not only getting the money from the federal government they need to, but it's still a priority. And you must recognize it as a priority, and as you develop your budget, state budget, and not only that, you know, get on some of these Medicaid advisory committees in your state. Each state's supposed to have a Medicaid advisory agency within their states, and so they are required to also get input, right? And so you got to get on some of these advisory boards and at the state level, and make your stuff known, right? And unfortunately, Matt, I keep saying this, you know, there's too many people out there are not fighting, right? They're accepting things as they are. That's no longer something you can no longer stay out of the fight, right? You know, I'm aging out here, and I'm still seeing that there's still a fight. There's still unfinished work, and I'm doing my best to spend time on those things that are most important. But I also recognize that there's another generation of leaders who need to come out and really hit this stuff hard, younger folks, right? There's no reason why the largest rate of people going into nursing homes should be under 30. There's no reason why that stat should exist, right? Right? That we are allowing that to occur. But we know one of the number one reasons why that is happening is not only attitude of decision makers in regard to having an institutionalized bias versus a community bias, but there's a lack of accessible housing for folks. And so when they go into hospitalization long term and they get going into rehab for a short term to get, you know, rehabbed, they lose housing, what they might have, and then you can't find a suitable housing. And so if you don't have a place to go, where are you going to go? They're going to get you on into a nursing home. And once you get there, it becomes very hard to get out.
What people can do.
So for people that say, okay, I'm ready, I want to get into the fight here, what are a couple concrete things like they could do today or within the week to really get them plugged in and moving in the right direction?
Yeah. Number one thing, go to NICL website, NCIL.org, National Council on Independent Living, and visit our Action Center. There you're going to get a lot of information about what is happening at the federal level and the things that you need to work on the state level, right? Pay attention to our call to actions, right? We put out a lot of call to actions, right? Connect with your local Center for Independent Living. And, you know, every state has centers for independent living. Counties have centers for independent living. Start there. Get involved. Connect with your statewide independent living council. Every state have a statewide independent living council. Every independent living council, statewide independent living council, must develop a 3-year state independent living plan, which talks about the kinds of things that need to be done over the next 3 years in regard to state level stuff. That often includes objectives of, you know, increasing home and community-based caregiver services rates and other stuff in regard to attendant care shortages. A lot of that stuff is built into those statewide independent living plans. And centers for independent living all advocate at the state level and at the local level. Sometimes it's a local fight, sometimes it's a statewide fight, depending on what the issues are. But all of it always depends on what's happening at the federal level. So that can't be overlooked because a lot of the stuff trickle down from the federal government and based on the decisions, the positive decisions or the negative decisions that are made. When the Biden administration was in office, and I was working very closely with the Biden administration, we had a bunch of stuff in place, right? The 504 final rules change was a game changer. For the first time, it was saying medical providers could not use unconscious biases to work with patients. For the first time, they had to have medical equipment in their facilities, you know, exam tables and scale weight, accessible weight scales, and all of these things. They could not turn away patients, right, because they didn't feel comfortable working with them. So those final rules was game-changing stuff, and now the administration is trying to change that stuff. So we can't make, at the federal level, we can't allow that to occur. Also, with the Biden administration, we worked very hard with airline traffic rules, right? For the first time, you know, airlines would be responsible for replacing your chairs at your decision in regard to where to get it, not theirs, right? And they were required to have mandatory training, and they were supposed to be working on models of allowing people to stay in their motorized wheelchair when they fly. All of that stuff is now being, you know, pushed back, right? And it is being quietly done. But those things was an amazing accomplishment. Even the Affordable Care Act was putting things in place, and now they're trying to, obviously, they turned that in regard to the credits and all of that stuff and made that no longer exist. But we was making some great strides in regard to advancing. Can you imagine being able to fly in your airplane and stay in your own chair? It's the reason I don't fly anymore, right? And Maria Town just had a problem with, you know, executive director of AAPD, and they, you know, they're getting that chair destroyed. And I forget the other lady who just, but it's still occurring, and it's occurring. It wasn't occurring as much prior to the Trump administration, but now it's just over again with the airline. They don't need, they recognize they ain't got to do anything, so they don't care anymore. So your wheelchair is going to get tossed around if you travel out in the airlines. I'm telling you right now, I wouldn't recommend traveling with anyone who really depends on their complex wheelchair. I wouldn't advise you to get on these airlines at all. I'll be honest with you. But that's what we're fighting. That's why the federal government matters, Mac. That's why the state matters. That's why local stuff matters, right? And we got to be active in the local level, statewide, as well as federal. and there's no longer sitting on the sidelines. Everybody got to get into the game, and everybody got to start fighting.
Perfect note to end on. So go to the NICL website, ncil.org, get those resources, get connected with your Center for Independent Living, ask how you can help in this fight. Share this podcast with people. Send it out to your contacts on their email or post to social media. We want to get the word out. The urgency here is important. That's kind of a redundancy, but the urgency here is high. People are being affected already.
Keep doing the work, man. Appreciate you.
Appreciate you too.